Well, health care coverage for illegal immigrants may be banned under federal law, and it is. But a new report shows that out of 25 U.S. counties with the largest unauthorized immigrant populations, 20 of them have programs that cover medical costs for illegal aliens. It costs taxpayers more than $1 billion a year. Here to break down the numbers on this, Stuart Varney, host of Varney & Co. on the Fox Business Network. We're glad to have him this morning. Great to see you, Stuart.
Thanks very much, Tucker. Nice to be here.
So this is illegal, and yet it's happening.
Yes, that is precisely right. They don't get health care coverage from the federal government.
Right.
And they're not part of Obamacare, but counties in America with a large number of illegals in those counties, they do have programs to provide free or very, very low-cost health care to illegal immigrants. As you just pointed out, it's the Wall Street Journal. They've looked at 20 counties in America and found that they are spending $1 billion a year to provide free or very low-cost coverage for illegals. They get doctor's visits, flu shots, drugs, lab tests, some surgery, all paid for by local taxpayers. Now, all illegals, of course, can go to the emergency room. That's the law.
Right.
You're sick, you go to the emergency room, they got to treat you.
Anybody can.
Anybody can do that. So now you add on top of this the free coverage that's given in some counties in America, and you've basically got health care coverage for illegal immigrants being paid for probably by middle America.
Of course, because there's so much federal money to the states. Hillary Clinton has now come out for adding illegals to Obamacare.
Her daughter Chelsea said yes.
And she has now said.
Let's cover it. She's now said
yes.
That's right. So what you've got here is that you are stabilizing the illegal population in the United States. They've got education, they've got health care, they've got driver's licenses in many cases. They are here. That entrenches their position in America and seriously squeezes local budgets. You want to build a new road, you want to build a new bridge, and yet you've got to pay for illegal health care coverage at the same time. You're getting squeezed from all sides here.
Such a good point. It's suicidal.
The politics of this, to me, is that most of these counties are Democrat-run.
Of course.
I think the Democrats are buying votes. They're buying the Hispanic vote with somebody else's money.
Of course.
That's my political interpretation of what's going on.
Well, after health care and schools comes voting. It'll happen. You watch.
Yes, and I spent 40 years as a legal immigrant, not being a citizen, and I couldn't vote. You realize that?
We are glad to have you.
Thank you very much indeed, Tucker.
You are a living argument for some kinds of immigration. Thanks a lot, Stuart.
Thanks, Tucker.
Well, the New York International